Hello everyone, Dr. PK from Dr. PK Life. It's part of a video series called Your Question, My Answer. A viewer recently commented, I'm only 27, they found a polyp during my colonoscopy. You're only 27 and your colonoscopy found a polyp. Does that mean you are getting colon cancer? Not necessarily. Think colon polyps only happen after age 50? Think again. More young adults are being diagnosed with the polyps or even colon cancer. If your doctor found a colon polyp in your 20s, don't panic. We're going to discuss more about it. So the good thing is that they found a polyp and they removed it. I want to reassure you, finding a polyp does not mean you have colon cancer. In fact, most of the colon cancer are not cancerous. Most of the colon polyps are not cancerous. They're a small growth that develop in the inner lining of the colon. The reason we perform colonoscopy is to find and remove those polyps before they have a chance to become cancer. Think of this way, colonoscopy isn't just a screening test. It's actually a cancer prevention procedure. Now, the next question is, what type of polyp was it? There are several common types. Three main types are hyperplastic type, adenomatous polyps, called adenoma, and sessile serrated lesions. Hyperplastic polyps are usually harmless, rarely become cancers. Adenomatous polyp, adenoma, they're the most common precancerous polyps. They may take 7 to 10 years and even longer to become cancer if left untreated. Then you have third type called sessile serrated lesions. They're another type, and they can also become cancer over time, especially if they're larger, have abnormal cells. But when they are found and removed, the risk drops dramatically. The pathology report tells your doctor exactly what type of polyp you had. So, why are we seeing more young adults with polyps? Over the last 2 decades, doctors have noticed concerning increase in early onset colorectal cancer. Many cancer diagnosed before age 50. We don't know all the reasons, but the several factors are being investigated as a contributor factor. And obesity, number one, processed food, low fiber diet, physical inactivity, smoking, excess alcohol, family history, certain inherited syndrome, and inflammatory bowel disease. Most young adults with a single polyp do not have one of these inherited syndrome. But if you have multiple polyps or a strong family history of colon cancer or colon cancer diagnosed in relatives at a young age, your doctor may recommend you to get genetic counseling and earlier surveillance. So what happens next? Biopsy determines whether polyp was completely removed or not, whether additional treatment is needed, when your next colonoscopy should be. For many people, the next colonoscopy is recommended 3, 5, or 7 to 10 years, depending on the type, size, and number of polyps. Here's the good news. If your doctor found the polyp and removed it, that's exactly what we want. Removing precancerous polyp dramatically reduces future risk of colon cancer. So instead of thinking they found a polyp, think they found it before it became a much bigger problem. That's a preventive medicine at its best. So finding a polyp in 20s can be scary, but in most cases, it's an opportunity to prevent cancer. Know your pathology result, follow your doctor's surveillance recommendation, and don't skip your future colonoscopies. Early detection saves lives. I'm Dr. PK from Dr. PK Life.